My first impression of Allscripts Patient Portal was it was something that, as soon as I saw it, it was something that I wanted to implement in my practice. I was the one who went to the medical group and said, we need to do this.
Basically, we wanted to make sure that our patients had the best quality of care that they could have.
So our relationship with Allscripts and Intuit Health has been great. They've been very responsive to our needs. Anytime we have issues that might arise, they've been very responsive in fixing those things.
Allscripts has always been very good about listening, taking our feedback. They go right back, they get it going in development, and we usually see within the next release or two those enhancements or those suggestions that we've made.
A lot of patients complain they can't get through to on our phones, or we're not in the the after hours. And so with the Allscripts Patient Portal, they're able to do that after hours. We have really significantly reduced patient calls, probably about 40 to 50%.
Having Patient Portal has improved our ability to communicate quickly with patients the results of their tests. Our turnaround time in the paper world is something around 7 days, but with the portal in place, we're able to communicate real time, almost the same day.
I think it's a very, very big time saver for me. And in my workplace, I think it helps with HIPAA for myself because I'm not on the phone saying out loud, what my prescriptions are.
We've had several patients who are hard of hearing, and with that, they just really adopted the idea of our patient portal because they are able to now communicate with us through the patient portal and not have to worry about being on the phone or actually even having an interpreter.
I have found this portal not to be a hindrance to my relationship with patients, but actually a way of augmenting it. This allows us a better way to keep in contact with them. It doesn't replace the face-to-face visit with them, but it allows us to follow up and see how they're doing from one visit to the next.
This program does allow for us to communicate with many people from many different backgrounds and eliminate the language barrier and communicate clearly, electronically, with no question as to what is being said.
One of the biggest huge wins for St. Vincent's Medical Group with use of the Allscripts Patient Portal was the online bill pay. I would estimate that there is probably a 30% increase of growth with the use of the online bill pay.
I think that Patient Portal would definitely be a key reason why I would choose and/or stick with Dr. Reynolds.
If you took Patient Portal away from me as a nurse, it would just make my day a whole lot longer and I'd be on the phone a whole lot more.
So we have a joke that whenever anyone always says, Pam, what do you think about the Patient Portal? And I always tell them, well guys, I am totally into it.